My name is McClain Sampson. I'm an associate professor and center director here at the Graduate College of Social Work. I joined the Social Work College in 2011, and I really love this job because it helps me pursue my passion. When I was out of undergraduate, I knew I wanted to do research, and so I was a volunteer at a research lab, but it was in clinical psychology, and the professor said, "Your calling is social work." Once I learned more about social work, that it was about activism and advocacy, I knew it was the place for me. So I came here and was able to pursue my passion of promoting mental health well-being among mothers. And that came about because when I was pregnant with my first child and going to the various health provider appointments, I realized that even though I was very stressed out and it was probably visible, nobody was asking me about my mental health. So my justice mind started thinking, what about mothers who are more disenfranchised, who are isolated? Maybe they're suffering alone and nobody's checking on them. They're only focused on the baby during that phase. When I came here, I was allowed to pursue my passion of developing an intervention that could reach more people. What we know about postpartum depression, it does occur in 1 in 8 women, and it occurs at a higher rate among low-income women. But it's harder to engage them and keep them in treatment. So things need to be affordable, they need to be accessible, and they need to be relevant to mothers who are living chronically stressed and often low-income settings. This intervention is community-based, and we have home visitors who teach a problem-solving tools intervention that helps the mother learn how to follow a stepped process to achieve her goals and to increase her self-efficacy, which then decreases her depression. Alongside that work, I am also the director of the Globe Behavioral Health Training Program for our master's students. We train our practitioners to work with medically underserved populations and engage them in treatment and keep them in treatment in a way that makes sense for them. So through that work and my postpartum depression research, I feel that everything I do here is aligned with the GCSW vision to achieve social, racial, and economic justice, because all of my work works with low-income populations who often don't have a voice in their own health and health care, and finding treatment that is relevant and accessible and meaningful for them.